We welcome you once again to the learning platform of Raphal Medical Centre. As you know already, this is the platform where we share health information and ideas to keep us healthy on a daily basis. Today we discuss an important topic, that identifying the sick child. Unlike adults who can easily know or predict to say that they are sick, children on the other hand are kind of disadvantaged, especially the under 5. And so most often before parents pick their sick children, it means that this child has been sick for days, and that is why they might report to the hospital in what seems to be a rather bad case. Most often, until we see that our kids are having temperature, that is the fever, or they are vomiting or having diarrhea, we assume they are doing very well. But then there are other petty informations that if we are able to gather about our children, we might be able to pick their symptoms earlier. So, what are some of those signs or symptoms? Before you can do this, you have to be very familiar with your children. Being familiar doesn't mean knowing their name, their color, or their scent. I want to say that you have to know the activities of your child. You have to know their eating habits. You have to know their sleeping habits. And then you also have to be familiar with their activeness level, because most often this is where the changes start from. And so maybe you have this child who only sleeps at night, but then you notice that these days the child wants to sleep during the day, and at the same time they sleep for longer hours. You might also notice that this child is refusing even their favorite meal. Sometimes they might not refuse the meal, but you also notice that the quantity they take or the excitement they use to welcome the meal is not the same. At the same time, you might notice that this child might sleep at night and then is very restless. Maybe it's a child who formally sleeps and then wakes up the next morning. But if you notice that your child wakes up more than 3 times in the night, which you know it is not usual, then you should begin to pay attention to. Because we all know that parents are busy these days, and most often these children are left in the care of their nannies, and so we miss a lot of important things. I would advise that maybe twice in a week you should be the one to do the hygiene in terms of brushing their teeth, bathing them, feeding them, and etc. When you do this, you'll be able to pick this very important and vital information. In the period of bathing them, you can check their ears. If it's a child, you can check the private. If it's a female child, you can check the private part, even the male children, because sometimes it might even be a diaper rash that is developing, and if you don't pick it on time, it might get worse. Certain times this child might just be having maybe an ear pain, or there might be a discharge from the ear. Until you pay particular attention, you might not be able to pick these symptoms on time, and that is when you are likely to go on admission when you report to the hospital, because most often we report and at that time the infection rate has gone higher, and that is where probably your child might need more than just an oral medication. We want to share this information so that we can save ourselves some time, because the period we stay on admission is part of our productive hours. We can use those periods to work and get money to cater for these children. So what I'm saying is that henceforth, let's allocate some time for the hygiene and the maintenance of our children. Let's try to engage them. Let's try to get to know them better, so that if these changes begin, we'll be able to pick it early. Once we pick it early and you report at the hospital, you are likely to be treated on OPD basis, so that we don't go on admission often. The less admission, the more time you have, the more you save money, and then the better life we all enjoy. I'm sure you've learned something new, and we are all going to put it into practice. Thank you for giving me a listening ear, and see you next time. Bye bye.